morning, everyone. Well, after listening to Her Excellency's story there, I feel like it's a tall order for me to come behind Governor. I always enjoy just the way that she has this gift to engage and just really captivate the audience. So if you enjoyed, her epic stories, let's just join me with giving Governor another round of applause. It is certainly a privilege and a responsibility for me to stand with you today under the theme, Lighting the Way. I want to begin by recognizing the extraordinary commitment of the Alex Panton Foundation and everyone who makes this symposium possible each year. As I arrived this morning and I saw the long line of individuals waiting to register, I thought about Alex and his family, and to see how many people this event brings together is certainly a legacy that Alex has left here. Bringing together, let's give a round of applause for Alex. Bringing together young people, counselors, psychiatrists, nurses, educators, parents and community leaders is no small undertaking. And I thought about that leaning on the mountain on your shoulder. I thought about all of those who work so hard to keep this foundation going. I'm sure at times it probably feels like that. But when the well-being of our youth is at stake, it is work that matters deeply, and I'm sure it's very rewarding. There is nothing more precious than the health and hope of our youth. And I stand here today as Minister for Health, Environment, and Sustainability, but I also stand as a mother and as a fierce advocate for our young people. One of the first priorities that was set upon assuming this role was to elevate youth mental health as an urgent focus for the ministry and for the NCFC government. And I'm so honored to be working closely with Parliamentary Secretary, former Premier Wayne Panton, who we all know has a passion for driving mental health focus and attention forward. Because the truth is, we cannot light the way forward if we refuse to see the darkness in some of our young people and what they are walking through. Data analyzed with the support of the Alex Panton Foundation tells us something that we cannot ignore. Approximately 12.5% of high school students in Cayman have received a mental health diagnosis. And girls are reporting significantly higher levels of distress, with research showing that twice as many girls as boys say they are unhappy with themselves. Behind every percentage is a child. Every statistics, there is a story. A young person sitting in a classroom, a teenager scrolling silently at night, a child smiling on the outside but struggling within. Some of them may even be here today. In our community, culturally, it can be uncomfortable to talk about suicide and mental health. But if we are serious about lighting the way, then we must be willing to look directly at the realities that our young people are facing. Sometimes we think we need the perfect words, but often what a young person needs most is not advice, it is just presence. Listening creates space. Listening builds trust, and it can interrupt isolation. We ought to ask ourselves, am I listening to fix or am I listening to understand? If we're going to encourage young people to speak honestly about their feelings, then we must create environments where they feel safe enough to do so. In the schools, in our churches, on our sports fields, and even in our clinics and hospitals. Since becoming Minister for Health, I have worked to ensure that the voice of the community is what informs our policy decisions. We are advancing a national mental health policy and developing a national campaign focused on recognizing the signs of suicide. And I just want to say that I think this is probably a good time for me to highlight the hard work that the Ministry of Health have been doing long before I took on the role as minister. And the mental health policy and the campaign on recognizing signs of suicide is something that almost every member of staff in the Ministry of Health, and now even the Ministry of Environment, are all passionate about. Education is one of the most powerful prevention tools we have. When students, parents, employers, pastors, and even coaches are equipped to spot warning signs and respond with empathy, we can then create a network of protection around our young people. We have committed to the creation of a dedicated mental health adolescents ward at the Anthony S. Eden Hospital to provide age-appropriate, gender-segregated inpatient care when it is needed. Funding has been secured for a new purpose-built youth mental health facility, and we are looking forward to working with CEO Lizette as we get that going in the near future. Plans are also underway for a mobile mental health nursing team to deliver rapid community-based crisis response and continuity of care. And one of the things that you will hear a lot of us talk about with health is we're now trying to do a lot more preventative care. We're going to be talking a lot about preventative care from our public health clinics. And so, again, we want to ensure that mental health also receives preventative care, and this is how we intend to do that. We're also strengthening governance through the Ponciana Mental Health Advisory Council to ensure accountability, strategic oversight, sustained national dialogue and education, including expansion of suicide prevention, training access. Also want to just acknowledge the director, Miss Marcia for Ponciana, who is here today with her team, and I'm going to invite you all to just visit their stall, which is just outside here to the left, just to see what is happening at Ponciana. But certainly the facility continues to grow, and I lost my train of thought, but our training programs are continuing to develop, which is something that is so important for the residents there at Ponciana. So there is still more to be done, and government facilities and policies alone cannot light the way. Light travels person to person. When a young person loses hope, or even an adult, an entire future is dimmed, dreams unrealized, talents undiscovered, leadership that never emerges. If we lose even one young person to suicide, the whole community grieves and is devastated by the loss of that light. Each of us holds a light we can all carry for the next generation. And while you may not consider yourself to be in a position of power or influence, you are. You're a parent, whether you're a teacher, a friend, a mentor, a colleague, a neighbor. You are an individual who carries a light. And today, being here is an opportunity for each of you to strengthen that light. So I urge you, myself included, to use today to learn new skills that might help light the way for someone else. There is a wonderful roster of speakers. I'm certainly excited to listen to our Chief Justice, who's up next. We also have expert clinicians, specialist counselors. Just being here and learning one skill, having the confidence to overcome some of the taboos that we all face, or to ask one deeper question that might help in an uncomfortable conversation, can have a profound impact on someone here, or even someone you may encounter after leaving here. So sometimes lighting the way does not require grand gestures. It requires courage, compassion, and consistency. And I thank the Alex Panton Foundation and all of the founding members for continuing to lead this national conversation with conviction and hope. And I was just trying to jot down, going back to Governor's epic, the last story that you shared. I know you said the The first gentleman was Gilgamesh. And who was the young man, his friend? Enkidu. And what Governor said really resonated. Where you have set your heart, you begin your journey. And so I know that beginning this journey with starting the Alex Panton Foundation certainly couldn't have been easy. And I know I see some parents in the audience today as well who've also experienced immense loss. So being here today certainly isn't easy, but it's your heart that begins your journey, and the light of your loved one will continue to shine through you, just like the lighthouse, and it will help someone who is lost to find their way. So thank you for all that you do, for all of you who are here today, and I wish this discussion today to be hugely successful to everyone who is here. Thank you.